Hello, I am Dr. Vidya Bisla, consultant gynecologist practicing in Sector 15, Gurgaon. Today we are going to discuss about the routine antenatal care that is important in the first 3 months of pregnancy. Soon after knowing that you have missed your period, you can do a pregnancy home test kit, and if it shows 2 lines, that means it's positive. So from that point onwards, you should be under the care of a qualified doctor. On your first visit, you would be prescribed some vitamins which are important for the proper formation of the baby, and a few tests would be recommended to you after a general checkup of your health. After confirmation of this, we do certain blood tests for your general health and also certain infections that are important from the pregnancy point of view, which can affect the health of the mother and the baby both. Like thyroid test is important, thalassemia screen is important, certain viral infections which we do routine for everybody, and which should be done right in the first trimester around 7 or 8 weeks, so that in case there is a problem we can start the corrective treatment for that. During pregnancy there are going to be a lot of changes in your body. From outside we may just see that the person is gaining weight, but the internal physiological changes that the body has to undergo to adjust for the growth of the pregnancy are also tremendous. For example, the total amount of blood also increases in the pregnant lady. So in case you have a certain fitness level, you are able to handle these changes very well. For people who have been active before pregnancy, they can handle it more easily than persons who are not active. But still, at least whatever your state of physical activity before, you can start a daily walk of at least 30 minutes at a very normal pace where you are not breathless while talking and walking, right from the day when you come to know that you are pregnant. So after exercises, then you need to watch your diet. In diet, the most important thing is that we have to take a nutritionally balanced diet. In the first 3 months of pregnancy, the energy requirement does not increase, but it has to be a balanced diet which gives you adequate amount of proteins, vitamins, minerals and carbohydrates to give you that energy to handle those changes occurring in your body. So there are certain, you can eat almost everything, but there are certain foods which are known to contain chemicals which are harmful to pregnancy. Those should be avoided. For example, Chinese food contains Ajinomoto. So you should avoid Chinese food. You can maybe make it at home if you are fond of it without adding Ajinomoto to it. Then coffee contains caffeine, that should be avoided in pregnancy. Generally cold drinks of all the colors are not good for a pregnant lady, so avoid those thing in your diet. Junk food, because it won't give you any minerals or vitamins, also should be avoided. Then a handful of nuts in your daily intake of food is going to give you a lot of energy and minerals and proteins. So those are recommended for almost everybody. They will not harm the pregnancy in any way. There are a lot of myths associated with it, but they are all false. Any medicines, any self-medication should be strictly avoided in pregnancy, because there are only a few medicines which are safe in pregnancy which we recommend. So whenever you see any doctor for whatever ailment, you must always tell the doctor that I am pregnant, so he or she can take care of the medicines in that sense. In case you need any further queries answered related to all this, you can book an appointment through Lybrate.